Good afternoon. Good afternoon, everybody, and thank you for tuning in today. As a reminder, we're going to take a break for the weekend, and we'll be back Monday at 1 o'clock, and we'll be here every day next week at 1 o'clock. We'll begin, as we always do, taking a look at the data. As you can see from the data reported today, we continue to see a plateau, kind of holding steady at around 200 cases a day. Today, 203 new cases. Decline in hospitalizations, which is exactly what we want to be seeing. Sadly, another 11 deaths, which is a constant reminder of the toll that this virus is taking on the lives of so many Rhode Islanders. The fact is, I don't know anyone out there who's not struggling right now. In the most extreme case, people who've lost a loved one, but lots of people who are out of work, people who are struggling with physical health, mental health, stress, anxiety. I realize it's a time of unbelievable uncertainty. And so as I've asked you before, today on a Friday, as we end the week and begin our weekend, I want to ask everyone out there to think of one kind thing that you can do for somebody today. And it matters. It's important. It's a time for kindness and patience, creativity, flexibility, a recognition that we're not in this alone. Everybody is struggling in some way right now. So if you feel yourself getting agitated or angry or frustrated, I'd ask you to take a pause and take a breath. And I'd ask you to think of one kind thing you can do for another Rhode Islander today. Look in on a loved one, call somebody, exercise patience when it's difficult, deliver groceries. It's what's going to get us through this. And I have been so impressed by the kindness and generosity of spirit of Rhode Islanders that I have seen every day over the past 2.5 months. Let's hang in there with each other a bit longer. It will be the thing that gets us through this. We cannot change this virus. Nobody wants to be here. We are where we are. We're facing it as a nation. Rhode Island is handling it much better than many other states. And it's our kindness and our strength and our unity that's going to carry us the distance. Okay, today I want to spend a few minutes, as I said I would, talking about how I think about the process of moving in between phases. As you know, about a week ago, I lifted the stay-at-home order. I said that it was time to get out of our houses, reopen retail, construction, manufacturing, parks. Said you could go back into the office for a bit if you needed to. And it is the hope that we're going to get to another phase and even another phase and eventually, kind of get out of these phases and get back to quote unquote a new normal. The question that so many have asked is, well, how do you know it's going to be safe to move from phase 1 to phase 2? And if you get into phase 2, how will you know whether things are so bad such that you might have to go back a phase? So give me a minute to lay out how we think about it. I will say this. I do have a great deal of confidence. People have said to me, how's it going? It's going well. It's going well because by and large, Rhode Islanders are following the rules. By and large, we're seeing high compliance with social distancing, not a lot of congregating in parks or family gatherings as far as we can tell. People are wearing their masks, not everybody. If you're not doing it, I'm asking you to please grab a mask and go ahead and join the club. It's the right thing to do. No, we haven't had any real incidences of overcrowding in retail shops or grocery stores. Nothing that we haven't been able to handle. Retailers have been super compliant. So again, I want to thank you. In general, you should think about a month between phases. So from the start of phase 1 to the start of phase 2, start of phase 2 to the start of phase 3, a rule of thumb is about a month's worth of time, assuming everything goes well. Why is that? Because you start a phase, you make some changes, whatever those changes might be, increased gatherings, retail, etc. You want to do that for about a couple of weeks, and then you need to wait a couple of weeks in order to see the effect of the changes you made. There's no particular magic of 14 days specifically, but we know the incubation period of the virus is such that you want to, if you can, give yourself a couple of weeks to observe the impact of what we've been doing. So for instance, if the fact that we've lifted the stay-at-home order is going to get us into trouble, we won't know that for a couple of weeks from now. And so that's, as a rule of thumb, you could think about phases moving in about a month. So phase 2, assuming everything goes well, ought to start at the very beginning of June, assuming things go well. How do we move in between the phases? So we've decided after a lot of consideration, thought, consultation, 4 metrics that taken together, we think paint an accurate picture of the course that the virus is taking in Rhode Island, whether the virus is continuing to decline, plateau, or increase. And maybe we've prepared a slide. If you could please put the slide up. It explains these 4 metrics. The number one most important thing that we are going to keep our eye on as we move through phases is our hospital capacity. This is the thing that we cannot allow ourselves to get in a place where our hospitals get overwhelmed. It's what you saw happen in Italy. It's what you saw happen in New York City and other places. It's a scary place to be, and we don't ever want to get there. It's a challenge, right? Because again, what we're doing today would result in a problem a few weeks from now. So that's why we have to take it slowly. Right? These folks, some people are frustrated it's too slow. I get that. I wish it could go faster. Problem is, if you go too fast, 3-4 weeks from now, you could have an overrun hospital, and that's exactly what we want to avoid. So we want to be able to guarantee that every Rhode Islander can have access to the healthcare they need, including a hospital bed at any time they need, and that our hospitals will never get overwhelmed with COVID patients. Frankly, it's vital that if you, God forbid, have a heart attack, a stroke, you need to get to the hospital, there's a hospital bed and a physician and a care team to take care of you at all times. That is paramount in what we're trying to do here. Currently, about 30% of all beds that could be available for COVID patients are filled. That's about 20% in the ICU. That's great news. It means we have the capacity. I do want to take a second to thank our hospital leaders. They've done an unbelievable job at surge planning to flex the resources they have at each of their hospitals, and they've identified beds for COVID patients while reserving obviously the majority of their beds for non-COVID patients and medical emergencies. If we continue to see less than 70% of beds filled by COVID patients, and the same for ICU, then we'll know it's safe to continue to move to the next phase. If, however, we see a spike in hospitalizations and we end up with 85% or more of beds filled with COVID patients, either in the overall capacity or the ICU, then we may have to scale back. The second metric, relatedly, is new hospitalizations. So, and obviously it connects with the first. New hospitalizations are a good indicator of the trend that we're seeing. What's happening with the virus, increasing, plateau, or decreasing. So for example, if we're below 70% capacity in the hospital beds, but we're seeing a spike in new hospitalizations, that's a sign something's happening and we might not be ready to move forward. At the moment, we're consistently seeing fewer than 30 new hospitalizations a day. Some days it's less than that. So obviously, if it stays at that rate over the next few weeks, it'll be safe to go ahead and move to the next phase. If, however, we get to a place where all of a sudden we start to see consistently 50, 60 new hospitalizations a day, that's a warning sign that we may have to pause. The third metric is the rate of spread. It's a good indicator. It is a good indicator of where's the virus going. Are we starting to climb back up on the curve? We've talked about this before. Epidemiologists measure the rate of spread with something they call the R value. So you see RT, you might see it in the news, the RT, the R naught, the R value. It all amounts to the effective spread rate. The simplest way to think about it is it's how many people does one infected person infect? So if I'm tested positive, how many other people will I infect? An R value of 1 means just that. It's 1 for 1. Each infected person infects one other person. That's a measure of stability. An R of 1 is a stable place. It's a place that our system can handle. It's a place that all of our systems, the hospital beds, the hospital surge, the testing, the contact tracing, everything, we could handle. An R value of, on the other extreme, an R value of 3, which is about where we were when we started this a couple months ago, that's a scary place to be. That is an unsustainable, scary place to be. That means one sick person is infecting 3 other people. And we estimate that, in March, we were at an R value of somewhere between 3 and 4. Today, we think we're just at about 1, maybe even a bit under 1. That's awesome, by the way. Hats off to Rhode Island. We were in such a scary place, to be honest. And now we're not. Now we're in a stable place. We're just below 1. And as long as we, continue to track that, we'll be in a very good place. So we're going to track the R value. If the R value continues to be around 1.1 or lower, then we think it's safe to move to the next phase. If we start to see the R value edge up towards 1.3, 1.4, 1.5, that means the virus is picking up steam. We're not doing a good enough job with social distancing and mask wearing and such, and we might have to think about going back a phase. I want to be crystal clear about this. The R value, how many people one person can infect, is absolutely in our control, totally in our control. If we wear our masks, that has a big impact on the R value. If we wash our hands, big impact. Stay 6 feet away from folks. Don't congregate. Stay home if you're sick. Get tested quickly if you're sick, and if you're positive, get into isolation. No, if you take a second now, we weren't doing any of those things when we started this 2 months ago. 2 months ago, we didn't know much about the virus. We were trying to wash our hands, but we weren't doing social distancing, the hand washing we need to, staying home when we're sick. We certainly weren't doing testing and getting folks immediately into isolation. We weren't mask wearing. That's how we've gone from an R value of 3.5 to 1. So if we continue to follow these rules, I'm very optimistic that we're going to continue to open our economy, move between these phases every few weeks without seeing our R value and our hospitalizations creep up. However, if we get out there and start to get lazy or lax, then we're going to get into trouble. And that shouldn't happen, because these steps, although they're frustrating and strange and annoying, we have to take them. And if we do, I think we're going to be in very good shape. Last metric also on the board in front of you is the doubling rate of hospitalizations. So this is a metric you've heard a lot about in the news. I have often talked about it. It's an important way to look at the trends of the virus. Currently, our hospitalizations are stable or even declining. So obviously there's no doubling that's occurring. We were at a place where we were doubling in hospitalizations once every 2.5 to 3 days. That is a very bad place to be. It means the virus is running away with itself. We want to make sure that I fully expect hospitalizations are going to go up. Let me be clear. We're going to start getting back to work. We're going to let the kids go back to camp. You're going to see hospitalizations go up. But as long as it takes more than a month to see a doubling of hospitalizations, we feel confident that we're in a good place and there won't be an overwhelming surge in our hospital beds. If we start to see a doubling of hospitalizations in 15 days, 20 days, then we're going to have to take a hard look, tread lightly, think about putting restrictions back in place, because it could mean we're in a bad place and our hospitals will get overwhelmed. So I would say, I hope this is a guide. I hope it's a guide. We look at it all in total. Obviously, we have to apply some common sense. We're not going to say that if suddenly we see 50 new hospitalizations in a single day, that we have to hit the brakes. We're looking for trends. Certainly, if you only have, 5, 10 people in the hospital, a doubling rate wouldn't be a problem. So, we have to, I'm offering these things, the doubling rate and metrics, so you have a sense of how we think about it, but it's common sense. If you go from 10 hospitalizations to 20, that's not an emergency. And then the last thing is, all of this is overlaid with an assessment of our systems. Are we where we need to be with testing? Are we testing people in the inner city? Are we testing vulnerable communities? Can we get to an outbreak in a facility quickly and get it under control? Is our contact tracing working? All the systems that we've set up. So I hope that it is clear or clearer how we're thinking about it. I will tell you now, our systems look great. Testing, contact tracing, PPE, all the masks, ventilator supplies, hospital beds. The systems we've developed are strong. They're in good shape, and we're going to continue to make sure that that is the case. I will say, I look forward to moving to phase 2, right? We started phase 1 and May 8th. I want to get to phase 2 very early in June. And then hopefully, knock on wood, very early in July, we'd be moving on to phase 3. And what we want to do in each phase is make changes and then hold steady on those changes. Observe them. Hopefully everything is in accordance with the metrics. Make some more changes, observe them, and then move on. The thing we really have to prevent is overwhelming our hospital system. We just don't want to ever get to a place where somebody can't get a hospital bed and they need it, or can't see a doctor, etc. Okay, two other quick points, both important, but I'll be brief. I want to make a special mention of a town hall that we're having for older adults. Next Thursday at 11 a.m., I'm going to be hosting a Facebook Live for older Rhode Islanders and their families and their caregivers. I'll be doing this in collaboration with Secretary Robertson, the U.S. Assistant Secretary for Aging, our own HHS Secretary, Wilmazetta Jones, and Rose Jones, who runs the Office of Healthy Aging, as well as several other community advocates. I would encourage you to listen in, to send us your questions in advance. You can submit a question to us at communications@governor.ri.com, and I look forward to it. This is a really hard time for older adults. You know, you're the most vulnerable and susceptible. You have to be careful, but yet also you want to live your lives. You want to have access to the support you need, the food and medicine that you need, the healthcare that you need, transportation that you need. I know it's an anxious time. I hope that this town hall gives you a chance to tune in, ask your questions, be with other people that have questions just like you. And it's our hope that we can help allay your concerns and provide you with support. Finally, as a reminder, Monday is the day by which businesses that are reopening or are already open need to have their COVID-19 control plan complete. There's an easy-to-use template online at reopeningri.com. You do not have to submit your plan to the state, but you need to keep it on file. So I'm trying to make this as easy as possible for businesses to comply. So it's a little bit of an honor system here. We are asking you to go online, reopeningri.com, look at the template, create a comprehensive plan for your business. If the inspector comes, you'll be asked to produce your plan, but we're not asking you to submit it in advance to the state. We're trying to balance public safety, public health with business friendliness, and I hope you find it to be a good balance. So I'm turning it over to Dr. Nicole, and then I'm sure you'll have a lot of questions, and I'll come back.
Thank you, Governor. Good afternoon, everyone. Thank you for being with us today. I want to also thank the dozens of people on the response team who worked so hard behind the scenes to inform the measures and approach that the governor discussed that we will be taking for the next few weeks and months. There are armies of people that have been involved with that. Rhode Islanders can be assured of that. I'll start with an overview of the data. We have 203 new COVID-19 cases to report today. We continue to have a robust testing program, and we'll see the cases associated with that. There are 272 patients who are currently hospitalized. Of these people, 63 are currently in the intensive care unit, and 41 of those 63 are currently on a ventilator. We unfortunately have 11 additional COVID-19 associated fatalities to report this afternoon. One person was in their 60s, 4 people were in their 70s, 2 of these people were in their 80s, and 4 of these individuals were in their 90s. We want to make sure it's known that our deepest sympathies are with the families of those we have lost. I know that everyone is going to be eager to ask questions about the approach that the governor has just outlined in terms of our movement between phases, but there's been a lot of news over the last day or two about the Abbot ID Now test, so I want to take a moment to address that. The Abbot ID Now tests are the tests being used at the testing site at Twin River. The FDA announced yesterday that it is going to be looking at the Abbot test. It's a rapid test that's used to identify COVID-19. They are looking specifically at accuracy issues and are investigating whether they could be due to the types of swabs used or the type of viral transport media used, which is the material used to transport the specimen safely and effectively. It's important to know that we validated the Abbot tests at the Rhode Island Department of Health's state health laboratories when we started using them in Rhode Island. Our state health laboratories confirmed their accuracy. It's also important to know that our positivity rate at the Twin River site is about 11%, which is essentially the same as our positivity rate in Rhode Island for all tests at all sites. So it is comparable, and that's information that's helpful for us. Abbot tests have been very useful for us in Rhode Island. They've allowed us to start contact tracing on thousands of people very quickly and to get them into isolation very quickly. The key for us staying in front of this as a state is being able to identify the people who have been exposed, who are positive, and quickly get them into isolation, identify their contacts, and get them quarantined so that they can stay local, stay close to home, and monitor themselves for symptoms. That's the way to stop transmission. That is the greatest value that we get from these tests. However, we know that there are limitations to any test. One limitation to the Abbot test is that it is a little less sensitive than a lab-based PCR test that we're using. It is a point of care test. That means for the Abbot test, as well as for our lab-based PCR test, in a normal scenario, the test is one piece of information that a healthcare provider in the office would traditionally use when evaluating a patient. We understand that. It's one tool in the toolbox, and it is a critical one. A person's symptoms are also an incredibly important piece of information. That's why we have been saying for weeks that no matter what your test result says, it is extremely important for people to stay home and self-isolate if they have symptoms. We've also explained for the last several weeks that the test works less accurately, less reliably if it's done on people without symptoms. And that's why we are only using it in those situations for specific reasons driven by the Department of Health when we want to use it to inform how we are evaluating the spread of disease. It's also why we have formed the Rhode Island COVID-19 Testing and Evaluation Task Force. We are very appreciative to these experts who have committed time and are already fully engaged in evaluating this test, the FDA antigen tests, the serology tests, to help make sure that all of us in Rhode Island have the information we need about how to use the tests best to our advantage. We are using many different tools to comprehensively understand the prevalence of COVID-19 in Rhode Island and to make data-driven, informed, science-based decisions about our next steps. I do want to close by reiterating that testing is still very important and very valuable. If you have symptoms, we want you to call your doctor. Engaging your healthcare provider is so important. Even if you go online and make an appointment through CVS to get tested at Twin River, it's helpful to let your healthcare provider know as well. Continuing to stay engaged with your healthcare provider so that you can get the support that if you have symptoms, no matter what the test result is, you continue to stay home and to isolate and to help make sure that there's no spread of any kind of illness, COVID-19, influenza, or any other viral illness that occurs. Having a positive or negative test result is one important piece of information to have when making decisions about what steps to take to keep those around you healthy and safe. We have and will continue to amplify the message that testing is important, being able to social distance effectively, having more than 6 feet in between yourself and others in public is important. Being able to wash your hands, use hand sanitizer regularly is important. Being able to have some form of cloth face covering is important, whether a mask or a scarf if you don't have access to a mask, making sure that you're washing it. And as we've said since the very beginning, if you have symptoms of any kind, staying home and recovering safely there is important. Call your healthcare provider, call an urgent care center, get evaluated, and get tested, knowing that all of those steps are going to be critical for us to continue to move from the phase we're in to the next phase safely and effectively as we reopen our economy here in Rhode Island. So with that, I will get us going with questions.
I think previously you had set a potential time frame for first phase around 2 weeks, or at least I think that was an impression that was given. What changed? And I think one item of note there is, I know Governor Cuomo mentioned that a number of states are going to open beaches on Memorial Day. You have mentioned that as a potential time. How does that affect this?
Yeah. So hopefully I said a few weeks, but in any event, okay, so my bad. The thing is, we have to observe. The way it works is you do things, stay-at-home order, whatever you're going to do, allow retailer to happen for a couple of weeks, 2 weeks, but then you have to watch them for about 2 weeks because you don't know the impact of those things until you've observed them for a couple of weeks. So, that's the way it is. That's the way, by the way, it's the way every other state is doing it. I've seen every other state. It's about a month between phases. Does that mean it might be slightly less than exactly 4 weeks or 28 days? Yes, but it's like, if you're asking today exactly the date of phase 2, I don't know. It could be that last weekend in May. It could be the 1st of June. It's like a rough estimate for people to do their planning. Beaches, we're still trying to figure that out. It'll be around that time. I mean, that's the plan. It'll be around that time, whether it's, I think Memorial Day is earlier this year. So I doubt it's going to happen the 23rd, but maybe the next weekend.
Governor, we're getting a rising tide of complaints or concerns about graduation ceremonies and many obviously disappointed parents and students, et cetera. And then almost a feeling of, well, we could have one, could school districts have one if they had appropriate social, what's your general statement to parents and students wondering?
Yeah, so the reason that this is so difficult is because it's a changing picture, and it's really hard to give guidance around what I think might be okay a month from now, listen, I'm just trying to do the best that I can to give the best guidance that I can. People are asking me, should I cancel my wedding in July if it was a 50-person wedding? That's a tough call. Like, if you can wait, it'd be good to wait. So what I'd say is, here's what I can tell you right now. Right now, and in phase 1, social gatherings are 5 or fewer. I have every hope and expectation and intention to lift that at the very beginning of June. So we don't know.
I wanted to follow up on that.
We don't know. So let me finish. So, I think the best, safest course of action and I think, fairest thing for these kids is to give them some certainty. And in the month of May, plan an event which is virtual, which is safe. It doesn't mean that over the summer, there might not also be some kind of a follow-up that's available outside in small numbers. That could be possible. But, for the month of May, if you're doing a graduation, it's got to be virtual, or 5 people or fewer, which is really virtual.
So
one of the complaints I've heard from parents is shifting goalposts.
Yeah.
Some have talked to the Department of Education, some have talked to the Health Department. And I'm curious, in these guidelines, when you sat around the virtual table, who was there? Did you have parent input? Did you have superintendents? The good example is North Smithfield. They were planning a jumbotron in the baseball field, right? Everybody in their car 6 feet apart. They were going to have kids come up, get out of their car individually, walk across the stage. Well, somebody apparently read them the Riot Act because they said, oh, you can't do that. And these say masks must be worn for pictures. In what world does that make sense for the moment that these kids, one moment, and some kids will only get this one graduation, you make accommodations for us to take off our masks, practical to talk to you, that a kid could not walk across the stage without a mask, then put it right back on and get back in his car. That makes no sense at all.
So I can't speak to that, and it sounds like neither can Dr. Nicole, because I didn't know about that particular instance. Let me say a few things. This is going to be frustrating. You see what's happening here. It's happening in every state, in every community, all around the world, frankly, and certainly all around this country. We're going to try to give you the very best advice we can, and it is going to be changing goalpost. Like, I don't set the goalpost. The virus sets the goalpost. So as we see things change, our guidance is going to change. That's also why we're taking it a couple of weeks at a time and going slowly. And that's why I've said to people, try to follow the rules. Now, getting creative is fine. Right now, the rules are pretty clear. Social gatherings are 5 or fewer. And you know all the other things.
Everybody in their car, 6 feet apart, one kid gets out.
I don't know those
Outside
details.
violence.
That sounds reasonable to me, but I am not going to opine on that without getting into the exact details. So I will get back to you, and I'll have Rhode get in touch with, what'd you say, North Smithfield? Because you're right. To answer your question, we have a call daily with mayors and town leaders. We have calls weekly with superintendents. We have calls 2 or 3 times weekly with our business advisors. The truth of it is, there are no easy or good answers. It's all, you know what I'm saying?
You seem to be, not you personally, government does not seem to be finding, let's find a creative way that takes into example the gravity of the moment.
Yeah.
Masks must be worn at all times, even during a virtual graduation where you have people walking across. Who thought that was a good idea, that you couldn't at least take it off for a quick picture and move along? And this is affecting
You're making
thousands
a
of kids
reasonable
across-
point. So let me say this. I would take issue with your characterization. I think we have tried to take into account the gravity of the moment, which is why I lifted the stay-at-home order before any other New England governor or Northeastern, which is why we lifted the guidance for funerals, which is why we're getting childcare back online on June 1st, which is why manufacturing and construction never went offline in the state of Rhode Island. So we are exactly trying to do that. We've also made a lot of accommodation for in specific instances for folks who are caring for the developmentally disabled loved ones, the end of life. So we really are trying to account for that, while also making it so that we don't see a surge in a way that hurts everybody. The points you're making are reasonable. I've seen a lot of creative solutions, and we will embrace those creative solutions. If what you're saying is that Rhode needs to work more closely with these school districts to do a better job of providing more creative ideas with graduation, I will take that back and I can act on that.
Is Rhode calling the shots, or is it the Department of Health?
They follow the guidance of the Department of Health.
Doctor, good afternoon. Wondering what might change in terms of waiving the physician's referral requirement for testing now that we've learned that the Abbott test has less reliability. Do you have enough tests if we were to abandon the Abbott test and go to, for lack of a better term, the National Guard test, especially in the urban core where we're seeing the 30%, 27% numbers? Is that a reasonable expectation that Rhode Islanders might have going into the next few weeks?
What we want Rhode Islanders to know is the fact that we are taking this information seriously, we are evaluating it, and we're balancing it with the benefit that we have received. We have benefited from very quickly identifying people who are positive. So we want to continue to benefit from that. We don't want to just abandon that immediately, but we want to figure out ways to continue to take into account, thus the messaging that I've shared, which is if you get a negative result but still have symptoms, still continue to isolate, still continue to make sure that you are staying away from loved ones to the extent possible before returning to work. Those are standard messages that are going to need to continue across the board regardless of the test. But we want to take this information that we've received and be able to see how we can apply that to our steps going forward without making any drastic changes right now because we have seen the benefit, but continue to take steps. This evolves every day. So we want to continue to take steps that help us understand what we're learning from these tests, understand where there are places where we need to be cautious, the importance of engaging with our healthcare provider community, getting a primary care doc if you don't have one, and communicating with your primary care doc. That's something we've encouraged from the beginning, and we want to continue to strengthen because that's how we're going to measure the overall assessment of what's going on, the test result, someone's symptoms, how they can respond, what our guidance is from the Department of Health standpoint. We want to continue to move in that type of direction as we go forward, taking into account this information.
What about the very specific waiving of the physician's referral, especially in communities where we're seeing these high numbers, sometimes from an Abbot test that might have close to 50% inaccuracy rate? Many people don't have either a primary care physician or any sort of relationship with the healthcare industry at all. Is there a chance still for those folks to just walk up to a test that's reliable without having the referral of a physician at this point? Do you see that as something as we move 2 weeks, 4 weeks, whatever it ends up being into phase 2?
Well, as we move forward, our critical piece is going to be really leveraging the tremendous primary care provider community that we have. This creates an opportunity that if someone does not have a primary care provider, we've talked about urgent care clinics, we've talked about the respiratory clinics that exist. We know federally qualified health centers are available. We've been speaking regularly to our primary care docs. They are ready. They are ready to re-engage with people who are their patients and then bring on the new patients so that everyone can get their vaccinations up to speed and all of that. So what we'll want to do as we go forward is continue to wrap around our expanded testing process, direct connection with the primary care and healthcare provider community so that patients can have the support they need. We've said from the beginning, if you don't have a primary care provider, call the urgent care centers. We're working with federally qualified health centers who are at the ready. We want to make sure we start to open this up. We're one of the best states in the nation in terms of insurance. We are aware of the underinsured. We want to use this to continue to build that primary care provider workforce that we know is so critical to this response and all other responses that we have going forward.
But basically, you're out of luck if you don't have a doctor right now and you don't have a way to connect with any of these testing sites. I mean, what steps are going to be taken for that population? I appreciate the answer. I'm just wondering if you can articulate.
The specific steps that we are looking at is being able to make sure as someone orders a test that they determine who their primary care provider is, or we use that as an opportunity to connect them to a primary care provider. The urgent cares and respiratory clinics, federally qualified health centers are at the ready to be able to do that. That's specifically what we want to do with going forward as we expand testing.
For the governor, the moratorium on ordinary court operations expires, I believe, Monday.
Yeah.
Has there been any examination that I think that's causing people a great deal of anxiety?
Yeah, I had hoped to have something to say today. The courts are still figuring it out, and they did it. Okay, they said they would have it out today. Maybe you could enlighten. So it sounds like it sounds like it just came out. So, okay, so I'll refer you to the courts. Nisi, as usual, is a step ahead of me.
Thank you. I'm also interested in the reopening criteria. I mean, I very much appreciate the hard numbers you've provided. I think people have really been waiting for that. But the third criterion, of course, the reproduction rate, the R0, is something that depends upon knowing the prevalence, how many people are infected in the community. And because we don't have any real handle yet on asymptomatic infections and carriers, how are we determining that? How are we estimating that? And how are we going to get a better handle on that?
Yeah, so R0 is a valuable measure to have because understanding the spread rate is important, and the governor shared how high it was when we first started at over 3, and the fact that we've gotten it down to 1. The point that you mentioned about prevalence is something that everyone throughout the country is grappling with on how to take the best information we have to determine that outcome. We know that we are the state that is testing the best. So we are the closest anyone is to obtaining a prevalence to be able to use that measure. And it's particularly why we're not relying just on R0. We also have the doubling rate. We also have the hospitalizations and the hospital capacity. So being able to have that as one of the elements that we refer to, knowing the challenges that exist with the calculation for everyone, is our determination for the best way to go forward.
I want to answer that in a slightly different way. She's the expert, and they have a team of epidemiologists, and they're the ones that do the models. Here's how I think about it. You do the best you can with what you know and what you have at every moment. So the question came up earlier about the Abbot ID Now tests. Listen, we are all learning every day. 8 weeks ago, no one even knew what an Abbot ID Now test was. And that's why we've assembled, thank God in Rhode Island, we have some of the best infectious disease doctors in the world and testing experts, Drs. Curtis and Caliendo. They're on this every day, all day. That's all they do is they read these studies and they're advising us as to what to do. I'll tell you, the Abbot ID Now test at Twin River alone has diagnosed about 3,000 Rhode Islanders positive. So thank God we've had it, because that's 3,000 people we could get care for and isolate. All are not. Our ability to calculate it today is so much more accurate than it was a month ago. And if we keep doing everything we're doing now with our sentinel testing, our serology testing, our PCR testing, in a month from now, it'll be that much more accurate. So it's what makes leading through this so difficult. And a lot of these questions, well, how come this is changing? How come that's changing? What I have promised to the people of Rhode Island is to provide the facts, to be transparent, and to do the best we can with what we know at the moment, and to change as necessary. So is R0 a perfect calculation today? No. Will it be better when we have more data in a month? Yes. Is that why we're killing ourselves to test? We're at 10% of the population now, more than any other state. That means we have better data than any other state.
What changed between when you lifted the stay-at-home order and we were looking at 2 weeks potentially, go to another phase, and now?
So clearly, in my own mind, I was saying, what I tried to say is we're thinking weeks, not months. This should be weeks. I have the 14 days in my head. We know you have to give about 14 days to observe what you've done for about 14 days. So I'm sorry if that created confusion. As a rule of thumb, and again, as a rule of thumb, people can assume it'll be, I don't know, a month-ish between phases. Now, even as I say that, if I come back on May 30th and say we're moving to phase 2, you're going to say that wasn't exactly 1 month from May 8th. So I'm telling you, roughly, you want to do things for 14 days and roughly observe them for 14 days, which is about 28 days, which is about a month, plus or minus. And the whole package of the R0, the hospitalization, the surge rate, it's a judgment call at the end of the day.
Nothing changed in what you're seeing in the data?
No, that was my mistake if I said that. I apologize.
The length of time on some of these measures, already hospitalizations doubling, is there a rule of thumb on how long one of these things has to happen before it would either trigger us going back a phase or stop another phase from advancing?
I'll answer that, but I want Nicole to answer that, because what we say is consistently. So we look for trends like 3 to 7 days. We're looking at a 3-day average. Some things we look at a 7-day average, but you better.
Yeah, the governor answered it well. The key is looking at the trend and gaining a sense of how quickly we are moving in a particular direction. If we start to see concerning numbers that are happening quicker than we would like, that forecasts for us that we're going in a particular direction, we may respond sooner rather than later. But in general, it's at least the 10 to 14-day time frame that you'd want to be able to see some of the changes determined while looking individually at the trend and the rapidity with which the trend is accelerating or decelerating.
As of this week, the ACI is at pretty much the same place that the Wyatt was a month ago. And so if we're following the same patterns there as at the Wyatt, we're going to be looking at a big explosion at the ACI in about a month. Is there anything being done besides the standard testing and the business as usual at either of these institutions to try to get on top of this?
Yeah, okay. So it's quite different how we're approaching the ACI. Like, we are aiming to test everyone, symptomatics and asymptomatics. In fact, have we done that? Yeah, so we've done that. We've tested all the workers, all the inmates. We'll continue to do that on a somewhat cyclical basis. We're doing our best to isolate folks. We have an excellent care team there. We've been better able to provide PPE to everybody there. So, I think we have a comprehensive plan.
And the testing process has been focused on where we are seeing the outbreak. So just to be able to add, the testing of the staff and the inmates has been connected to where that component has taken place. But the final point of why we are not anticipating 3 to 4 weeks from now having an additional repeat of what we've seen is a number of reasons. One is this was a proactive, comprehensive, aggressive approach at assessing what the risk of spread is. These weren't the fact that there was someone who was symptomatic and then it had spread, and by the time we found out it was too late. This was in advance of any of that occurring. We actually went in to do the type of testing to help us understand and determine, are we at risk of something like that happening? That wasn't the case in Wyatt when we were there. So we're going to continue that process as we go forward, as we have been doing in all of the congregate care settings, and we'll get to the place where we're able to assess that for all of the inmates and all of the staff. The other reason is what the governor mentioned. We have an excellent leadership and medical care team at the Department of Corrections that we work very closely with. They have done a phenomenal job up until now, even knowing that this was not just a reactive process of a cluster of cases. This was us going there proactively, looking to see how can we help prevent some form of cluster of cases or challenge from occurring. So we really credit the leadership there in Director Trish Coyne-Faig, as well as Dr. Jennifer Clark, who have done an excellent job with a huge team there.
What percentage of prisoners and, inmates and staff have been tested so far?
Let me get back to you with that number. It's been an active process because it's been just over 24 hours and we're moving forward with that.
I just want to clarify. So before we move to phase 2, it's not a 2-week period. People should regard it as like a floating start. Now, Memorial Day does start early, and people then had in their minds, okay, Memorial Day weekend, we move to phase 2. That is not the case.
Correct, exactly. Because Memorial Day is the 23rd, right?
Now,
Yeah.
The reason we're not moving right away into phase 2, does that have to do with the Abbott test, that maybe the infections
No.
were worse than we thought? It does not.
No, absolutely not. It's just, I don't know, I guess I'm poorly explaining this. You want to have enough time to observe the effect of the changes you're making in order to know the effect of the changes you're making. So you make a set of changes like allowing people to go shopping, and you let that happen for, say, 2 weeks, to know the effect that that change has had on the rate of spread of the virus, you need a little bit of time, the doctor just said 10 to 14 days, to observe those changes. So let's say I said on a Monday, we're all going to be able to go back to the beach. We let that happen for a couple weeks. If at that 2-week point you made more changes, you wouldn't really know the full effect of everyone going back to the beach. You have to observe it long enough. And the risk of not observing it long enough is, again, this virus will start to reproduce very quickly. And then down the road, in a few weeks thereafter, you'll start to see these doubling of hospitalization rates, hospital beds filling up, running out of hospital beds. So I hope that's clearer, but that's the plan.
I want to follow up on that.
He can
Just a
follow
quick
up.
follow-up on that. Now, the town of Narragansett, and Ted Nesi put this out, Monday, they're going to have a resolution. The town of Narragansett seems to be saying Memorial Day weekend, they are open for business, churches, police will not enforce the executive order. What's your reaction to that?
That's a huge mistake. You know, like I said, we are trying to encourage voluntary compliance. We are trying not to be heavy-handed. That is not based in fact, science, good analysis, and it's so selfish to all the people of Rhode Island who have worked so hard for so long, putting their lives on hold, their children's education in their home, their businesses on hold, so we could all be safe. I feel so confident if we go slowly. Every expert you talk to, the experience in every country who's done a good job of this, is if you take it slowly, you can get back to a good place. So to jump the gun a couple of weeks, you know, before we're ready, or to jump the gun, not so much a couple weeks, but in that fulsome way, it's a huge risk. It is a huge risk. So, you know, listen, I get people are frustrated. I do. I really do. It's my job to protect people. No one wants to have my job right now. These are tough calls, none of which are perfect. That is a reckless thing to do, and I really hope they don't do it.
They have the power to instruct their police not to enforce your executive order?
I'd have to look into the legality. I just hope we don't get there. Like, that's not where you want to get. We are, the people of Rhode Island are in this together. Let's be collaborative and cooperative. Why do we want to go down that path when there's no need for it?
Governor, do you plan to keep the 5 or fewer social gatherings rule for all of phase 1, or could
That's the plan.
Okay, so for now the plan is 5
That's the
until
plan.
you go to phase 2.
Right. That's the plan. You had your hand up and to get called on.
Thank you. Do you see allowing salons to open at the start of phase 2 or further on in phase 2? And what restrictions can owners see?
Yeah, we are trying to figure that out. We are, Stephen Pryor, the Commerce Secretary, there is not consensus within that community around what are the conditions and when we should do it. But yeah, we'd like to do it at we want to do it as soon as we can. So yes, we're aiming for the beginning of phase 1, and exactly what that will look like, we're still trying to figure that out.
Last question today, back here.
Good afternoon, doctor. Recently on local talk radio, there was discussion about people still testing positive, even though they no longer have symptoms and even though they feel fully recovered. Other illnesses such as mono, that can come up in your system even when you don't have active mono, you're not actively sick with it. Also a TB test where you would still be, no longer have TB, but it would come up in your system. So I'm wondering if that's possible with COVID-19, where it's no longer active in you and you're recovered, but it still will come up positive in a test.
Yeah, it's part of what we are learning overall with COVID-19, that there are differing ways that people sort of experience their illness. What you asked about helps reaffirm the message that we've said, that testing whether you have a positive test or a negative test, is one of the elements that we need to take into account in understanding how someone is doing. Someone that may have had COVID-19 or hospitals have done a great job caring for patients, South County, Westerly, Landmark, across the state. Our hospital leadership has been right where they need to be to help make sure that patients are cared for. And we've worked closely with them on how to assess when someone no longer needs the isolation or the type of care that's needed for COVID-19. And sometimes it hasn't been just the test that we can use to make that determination, because the test ends up continuing to be positive. So we put it into the context of, does the person no longer have symptoms? Have they fully recovered otherwise? Where can they return home to? How is their healthcare provider engaged and able to continue to monitor and care for them? So we want to make sure that we're learning everything we can with the tests. The governor thanked again our leadership for the COVID-19 testing and validation task force, Doctors Caliendo and Curtis, because the input that that entire group provides us is going to be critical in knowing how we'll balance what we've learned about tests with all of the other elements that healthcare providers take into account when we are assessing our patients, and to continue to reinforce to all Rhode Islanders the importance of staying home if you're ill, the 6 feet social distancing, wearing some form of facial cloth covering, and making sure that you're washing your hands. All of these elements are going to be essential for us to get through this together.
Thank you, everyone.
Thank you.